Welcome. I'm Mariekarl Vilceus-Talty, and welcome to Partnership Live, our monthly webinar where we speak to leaders in New Jersey about how they're impacting and changing the lives of New Jerseyans through healthcare. I'm joined today by Dr. Tia Welsh. Hi, Dr. Welsh, how are you? She's the chair of Women's Services at the Valley Hospital. Good afternoon, Dr. Welsh, how are you?
I'm good. Good afternoon. How are you?
It's such a pleasure to have you here with us, speaking to us about how you're impacting the lives of women and children and families in New Jersey. I feel like we've seen each other so much in the past couple of weeks, right?
Yes.
It's very, very nice. I want to start off just getting to know you a tiny bit. So if you were not a physician, tell us, what would you be doing?
Truly probably be a lawyer, but if you ask me what I would dream of doing, I'd be a famous actress.
I hear you. I hear you there. You'll have the opportunity participating in our symposium. You're leading one of the panels, correct?
Yeah.
So that'll, we'll go back to that later. The whole acting bug. We'll talk about that later. But currently, you have an extensive and very impressive background in medicine, and we have a few of the same stomping grounds. Can you tell me, why did you become an OBGYN?
This is a unique story that I think my father likes to tell. I always wanted to be a doctor ever since. I'm going to date myself. I got my first Fisher Price stethoscope and needle. However, I don't think it was until the Cosby Show where Peacock Huxtable was an OBGYN, and I said that's what I wanted to do, to be around, empower, and take care of women. That's where my heart lied. And I was probably third grade at the time, and ever since then, I knew that that's what I wanted to do.
That is truly wonderful. So you were appointed chair of women's services at the Valley Hospital in 2022. Yeah. How's that role for you? Can you tell us a little bit, share with us what your role is there?
So I am chair of all of the OBGYNs in the Valley Medical Group, and that also includes our specialists like our IVF, our maternal fetal medicine, as well as our generalists here at the Valley Medical Group. But in addition to that, I also oversee women's health services at the hospital, which includes any GYN surgeries that you may have at the hospital, of course, labor and delivery as well. And my third role here was to establish an OBGYN residency, which we are weeks away from hearing a final decision on that.
That's really, really exciting. And you, in terms of your background, I know you studied in New York. You were at downstate. Tell us a little bit about that extensive background.
I went to medical school at SUNY Downstate, and for those that don't know, that is in the heart of Brooklyn. And I stayed on to do my residency training at the same hospital. It is there that I met my husband in Brooklyn, who lives across the street. But the city hospital system of New York gives you extensive training. If I didn't see it, it doesn't exist. And after that, I did start my career in the Bronx at another city hospital, Lincoln Hospital in the Bronx.
And I say that to say not only to highlight your extensive background, but of course I like to big up New York and Brooklyn because that is my hometown. But bringing that extensive experience to the Valley Hospital, being new to leadership and having those fresh eyes, especially. Can you talk to us about some of the initiatives that you've put in place that are really impacting outcomes?
When I first came here, the Valley Hospital was operating as it should as a community hospital. When you're operating as a community hospital, not under the auspices of a big academic center, sometimes Evidence-based medicine isn't always encouraged or stressed. And when I came in, I said, hey, we are a community hospital, but the patient load, we did over 4,000 deliveries at the Valley Hospital just last year. And that was a 20% increase from the year before that. People want to be at the Valley Hospital. So I needed to make sure that it was safe. We were never, the Valley Hospital was never set up to handle that many births. We didn't have doctors or nurses. We were busting at the seams. So one of the first things I did was establish a laborers program at the hospital so that there is an employed physician there 24/7 for any emergencies. The second thing I did was to start to review policies and protocols. There were lots of policies for nursing, but no policies for the MDs. So that's something else that I did. I've increased maternal fetal medicine presence on the floor. So there's always a high risk doctor during the day on the floor for the increased acuity level that we're also seeing. In addition to that, I've increased the number of anesthesiologists that are available on the floor. Quite frequently, there was someone in the operating room, somebody was waiting for an epidural. So I ensured that there were 2 anesthesiologists on the floor at all times. And I have really been working hard to, one, establish a peer review committee that we look at systems so that we're always improving systems. And in addition, we are working hard to decrease our cesarean section rate. So all of these in place in just a year and a half, and we've made great strides in all of those things.
That is a human's job to do in just a year and a half. But talking about putting systems in place and looking at the disparities and being an advocate, we were just together at Bergen Community College Black Women's Maternal Health Summit. So it was really a great gathering of dedicated advocates and professionals and community leaders. And as a physician, I know there was a lot of questions asked of what are you doing at the Valley Hospital and what are you putting in to impact the lives of the women that you serve? As a physician, what was your experience and what did you take away from the day?
I took away the fact that it's not a one-man show when it comes to the maternal morbidity and mortality, especially in Black women. And it takes a few, not just physicians, but it takes our politicians. And to see how much the politicians were involved and enlightened made me happy. The fact that we had not just physicians, but other clinicians, nursing, as well as our doulas to support women in labor, I thought was fantastic. But one of the main takeaways is that not everybody, a lot of people are silent. And in the silence, we can't bring change. And the woman that stepped up to report their specific traumas or experiences really was impactful because it means that you're not the only one. And when we suffer in silence, everyone suffers.
100%. Absolutely. We had a specific speaker who talked about her mental health challenges, and that really brought many people to the forefront to say, well, I'm not alone. So when you speak to women that come to you and they're like, I'm terrified about what's happening in New Jersey because we see that the health crisis specifically for Black women is at an all-time high. We know that the NTSB rates, and there has been some successes, but still for Black women, there's no change. So when mothers-to-be come to you and say, I'm terrified of dying, yeah, how do you address those fears?
Several ways. One, I have ensured that I have brought more women or people of color into the department. I think that it's important for people to have cultural understanding, and so that there's a place of comfort there. If everyone in the boardroom was a white male, I would not find comfort there. So I want patients to enter the doors and feel comfort. Um, so that's number one. Number two, all of my practices, OB practices, they get together and they talk about their high risk physicians. I have more communication within the practices and externally, meaning when there is a high risk patient, I have demanded interdisciplinary meetings that include anesthesia, that include cardiology, so that we are all working together. You wouldn't believe how many times that you ask for a referral in the hospital, and they're all coming at different times and all contradicting one another without reading notes. So I require and request for extreme high risk patients that we get together and be on one accord even before labor happens. That's number two. Number three, just having more presence on the floor to have a safety net, I think is truly important. And four, I'm invested. I have hands-on experience. So as the chair, I not only see patients, I am also on the floor on labor and delivery. So I am extremely active so that I understand what it is that my physicians are going through and understand the experiences of the patients. So I have to have boots on the ground to understand what the needs are.
Absolutely. That is so important, having boots on the ground, people knowing who you are, that you're approachable, that they can, talk to you. When you talk about having that interdisciplinary team, can you share with me about your shared decision-making, having the patient as part of that team?
When patients come in, the first question I think that was asked at the symposium was, how do you know that you're getting good care? And
Sure.
you know you're getting good care when you are part of the decision making. So I encourage that at every level, that patients are included to find out what their desires are, what their goals are. So once interdisciplinary meetings do happen, we come back and we say, hey, these are all of the recommendations so that we can have an integrated process. Once I have secured that that is going seamlessly, I will start to include patients in those discussions as well. Right now, they're included in the discussion at the practice level, but not usually at the hospital level. But when everybody does touch base with the patient, they're all speaking the same language and they're asking the patient the desires before we even.
That is so very important. So if you have a family member who feels like they're not getting that shared decision making, what tactics or what process do they have um, to get to you, or to amplify those voices? How does that look?
In the hospital, we have patient relations. Many people will speak out to patient relations if they have skipped the nurse administrator on the floor or their specific nurse. In the practice, they have practice managers. So those are the first line people that are going to get news that there's someone that isn't totally satisfied. And I am the second line of, chain of command.
Mhm.
When that comes to me, there's not a patient that has written a letter or voiced concern that hasn't heard from me specifically. And on a case by case basis, we try to determine what the best course is to correct any failures that are on our part. Sometimes it's just the way things are perceived. So that's probably the biggest education that I do for the entire staff is intention always doesn't always match perception. And we have to get to a place where perception equals the intended goal. And sometimes that's difficult. Labor and delivery and giving birth is extremely emotional. So it's not always that we're at fault when someone's upset, but I do assess and I do speak to every single patient that has some concern.
Absolutely. It's really having that person as your advocate, that voices are amplified and being listened to, that is so very important. And to match that, I know I have all these noises going on. I'm sorry. Um, To match that, I know that there are new facilities coming in Paramus. So is there anything new that will be enhancing maternal care at the Valley Hospital, the Paramus site?
Absolutely. Not only will we have more labor rooms for patients, we have bigger labor rooms. There will be technology in every room. At the touch of a button, a code can be called, help can
Mm,
be called without leaving the room, without picking up a phone. Every room is equipped with a 72-inch screen television. So
wow.
every care provider that enters the threshold of your room, their name will be flashed on your screen, and you will always have record of who walked in your room. That's number one. Number two, we have increased our triage in uh, our recovery rooms on the floor as well. We have a whole floor instead of two separate floors. We have one enlarged floor for our postpartum patients. In the new building, in our current building, postpartum, which is where you're housed after delivery, is currently called mother baby. I have worked hard to try to change some of the naming of our wards in the hospital to be more inclusive. We have fathers, we have same sex couples, we have transgendered couples. So being inclusive in the new hospital is something that I'm really working hard to do. Our our department will be housed in the Women and Children's wing of the hospital. Have not yet solidified renaming that, but if I could, I would. But we will have our own wing, which will house pediatrics as well. And so some of our post-op GYN patients will be housed on that floor, and we will be equipped enough to handle more learners, more residents in the hospital that are that do really work hard to oversee safety and quality as well.
So very exciting. Makes me think just for a slight moment to go back and be a labor and delivery nurse, but then I'm like, no, it's okay. It's okay. But that does sound very beautiful and very exciting. You're not going to have any water births, is that correct?
Say that again.
Water births?
We do have the ability to do that. That hasn't been used. That's usually done in a birthing center. But we do have the ability to house our patients um, in a tub in the room if they want to while they're laboring. Usually, the midwives, we have our own midwifery practice, um, do utilize that from time to time, but we don't typically birth in those tubs.
Wonderful. So you have midwives and you have doulas. Is that correct? You have your own doula service?
We do have doulas that usually come to our hospital. We invite all doulas to come. We just require that they are certified. We had a very, very strict visitation policy during COVID. We are loosening up our range just a little bit. But during that time, we saw a really big uptick in, grandparents becoming doulas, sisters becoming doulas, so that they were there to advocate and to support the patients in our hospital. And we acknowledge that.
That's really wonderful. A lot of great things are going on over there, and I know our time is slowly coming to a close. But as we spoke about in the beginning, you will be moderating one of our sessions tomorrow for our maternal health and perinatal safety symposium. It's great that it's going to be in person. You want to talk to us a little bit, share with us about the panel that you're moderating?
I will be moderating a panel and talking about just what we just talked about today, the initiatives that Valley Hospital is taking to improve maternal health. And I'll be on that panel, and I'll also be moderating, oh gosh, I forgot her name. I think it's Dr. Quinn. I might be saying her name wrong. But she will be talking about transgendered health and how we can improve our outlook in the transgendered community.
Absolutely. And I know Valley is taking a step ahead and being ahead of the curve with doing that. So thank you so very much. I do have one last question for you. With all of your extensive experience working in New York, working in the heart of Brooklyn, and all of the experience that you've seen coming over to Valley, making such impactful changes to the system there, and really impacting the healthcare of women in northern New Jersey. If you were to write a book, what would that title be and why?
I laugh because I have always wanted to write a book. My oldest stepson has encouraged me to do so and gave me a mock up after I told him what I wanted to do. The title of my future book is probably I Will Never Forget That Vagina. That is based on stories and how it relates to Black maternal health and stories of really impactful patients that I have had during the years since residency.
That is excellent. I will never forget that vagina, and I'll never forget that title. And I can't wait to see it on the shelves to pen through and look at all the impactful stories that have shaped your training and your experience. Thank you so much for joining us, and I look forward to seeing you tomorrow at our Maternal Health and Perinatal Safety Symposium.
Absolutely. Thank you for
Thank
having
you.
me.
And thank you for joining us for Partnership Live. I look forward to seeing you next month. Bye-bye.